Hello and very good afternoon and welcome to our session on cervical cancer and HPV vaccination. Today we have Dr. Hemavathi Srinivasan. Thank you so much, ma'am, for coming. She'll be educating us on the topic and she's also going to give a brief on this topic and enlightening us on the same. So I'll request our doctor to proceed and you have the stage, doctor.
So good morning, everyone. Thank you, Nikita, for the kind introduction. Today, I'll be talking about cervical cancer and vaccination. This September month is considered as a gynecological cancer awareness month. So, I'll be talking about cervical cancer. PPT? Yeah. What is cervical cancer? It's a cancer at the mouth of the uterus. Where is this cervix located? As all of you are aware that uterus has three parts. One is the body of the uterus, and both sides we have fallopian tubes, and the lower part of the uterus is called cervix. When we view from downwards, the cervix will be seen like this. Cervix also play an important role during pregnancy and delivery. The cervix, the mouth of the uterus, normally the length is around 4 centimeter. When there is an incompetent cervix or the short cervix, the length is less than 2.5 centimeter. It may lead to preterm labor or delivery. So let us discuss about cervical cancer today. In general, cancer, how it occurs, it's nothing but rapid and uncontrollable development and production of the cells. This development of cancer cells may occur due to the familial inheritance, may increases the risk, of course, and proto-oncogenes and tumor suppressor genes become damaged by the carcinogens. The known carcinogens are viruses and bacteria, some of environment chemicals, tobacco, radiation, and dietary factors. So, why is cancer screening important? Because early cancers may not have any symptoms. When patients come to us with symptoms, it must be already in the late stage. So screening helps us to detect cancer at earlier stage, so there are better treatment options available. Some examples of types of cancer screening. For cervical cancer, we do pap smear. Recently, HPV DNA testing also available. When we do pap smear, we can pick up the abnormal cells so that we can subject into further confirmation or further testing. For breast cancer screening, we have a mammogram. So prevention is always better than cure. You should know about your family history. If you know any history of cancer in your family, you should get regular medical screening and this kind of screening test for cancers. And for example, breast cancer, you have to learn self-exam techniques. Keep watch on your diet and weight. Don't smoke and don't drink alcohol. Both increase the risk definitely. Become educated. Get aware about your cancer. These are some of the awareness ribbons for different cancers. The breast cancer, it's a pink ribbon, and cervical cancer, it's a teal or white ribbon. This is a cervical cancer disease burden in world. This is actually 2008 years, the data in which they say India is 27% of cervical cancer occurs in India. All over the world when you compare. The same time, the mortality, the death due to cervical cancer also occurs 27% in India when compared to the rest of the world. The risk factors, the major causative factor for the cervical cancer is the early marriage or early sexual activity and multiple sexual partners, unprotected sexual intercourse, multiple pregnancies, frequent deliveries and multipara, and uncircumcised partners, alcohol smoking increase the risk. So how it occurs, as I already told you, the virus called human papilloma virus is a major causative factor for cervical cancer. It spreads via sexual activity. The incidence of cervical cancer rises in 30 to 35 years of age and peaks at 55 to 65 years. There are different types of HPV virus serotypes are available, in which 16 and 18 account for nearly 77% of cervical cancer in our country. And serotype 6 and 11 contributes over 90% of genital births. The lag period, that means the starting of HPV infection and the real invasive cervical cancer, is about 15 to 20 years. Hence, screening helps early detection. So it takes long time. Once you get the infection, the cancer occurs at least minimum 10 to 20 years. So when you do frequent screening and annual checkups, we can pick up this cancer at very early stage. How does cervical cancer present? What are all the symptoms? Usually, abnormal vaginal bleeding is the most common presenting symptom of cervical cancer. Bleeding occurs in between your periods or bleeding after the menopause, that's after stopping your periods. Continuous bleeding through the vagina on and off, or abnormal vaginal discharge. It may be excessive, or it may be smelly, or it may be blood mixed. And bleeding after the intercourse. So post-coital bleeding is one of the main symptoms of cervical cancer. So you can stop it from happening, else defeat it by enlightening. So be aware about all the cancer symptoms and how do we protect, and share your knowledge and detect your cervical cancer by doing the screening test and protect yourself. So these are all the risk factors. Again, just want to highlight that HPV itself, so 99% of cervical cancer is associated with HPV type 16 and 18. It's responsible for more than 70 to 90% of all cervical cancers. Cigarette smoking and long-term use of oral contraceptive pills, and immunosuppression. Dietary factors like deficiency of folic acid and vitamin A. Sexual factors, multiple sexual partners, early age of first sexual intercourse, etc. Multiparity, more than 4 live births, and of course, low socioeconomic status is one of the common risk factor for the cervical cancer. So, protect yourself and look after your sexual health. The association between HPV and the cervical cancer. So HPV is a common virus that is spread through sexual activity. It can cause the growth of abnormal cells on a woman's cervix. If we are not treating it early or screening it or identifying it early, if we left untreated, these abnormal cells can develop into cervical cancer. So how can women protect themselves? One is by limiting the number of sex partners and use condoms. Okay, it may also lower the risk of HPV, protective for infection. Second is by getting screening, by pap test every 3 years or the HPV DNA testing. So these tests detect abnormal cells that can lead to cervical cancer. Third is prevention by getting vaccination. So by getting vaccinated against the types of HPV that cause most cervical cancers. So go for regular pap smears. This I'll just keep it. Does cancer run in families? Yes, it does. It may be associated with other cancers like ovarian cancer, colon, and uterine cancers. So screening for cervical cancer, there are 2 tests available. One is pap smear test, another is HPV DNA testing. Commonly, you can start from the age group of 21 to 29 years, pap test every 3 years, and above 30 to 65 years, pap plus HPV test every 5 years. Beyond 65 years, screening only for the high risk group. This is the way pap smear will be done. A small speculum is inserted into the vagina to widen it. Then a brush is inserted into the vagina to collect the cells from the cervix. So when we view the cervix, this is normal cervix and this is the cervix with the abnormal growth. This is 2030 targets. The last 2 years, we have initiated a lot of screening tests. Between the year 20 to 2030, The acceleration plans towards elimination of cervical cancers were initiated a lot. So the vision is a world without cervical cancer. The goal is below 4 cases of cervical cancer per 1 lakh woman years. So primary prevention is like 90% of girls fully vaccinated with HPV vaccination by 15 years of age. This is the first target. Then 70% of women screened with an HPV test at 35 and 45 years of age, not annually, twice the lifetime, and 90% managed appropriately. Then 90% reduction in mortality from cervical cancer. This is our aim for 2030. Yes, coming to the vaccines, the prevention of cervical cancer. We have two types of cervical vaccines in India. One is Gardasil, the other one is Cervarix. Gardasil vaccine protects against both cervical cancer and the genital warts. Cervarix protects against cervical cancer. Usually 2 or 3 doses based on the recommendations. But ideally, you have to vaccinate at the age group of girls between 9 to 12 years. But still, you can catch up vaccination up to the age of 26. So HPV vaccination prevent 90% of HPV cancers. Cervical cancer is one of the common cancer in females over 45 years of age. It is preventable by HPV vaccines. Remember that breast cancer we don't have vaccine yet, but cervical cancer we have a vaccine. Now recently WHO recommended single dose for 9 to 14 years girls. So parents who's watching this, please start vaccinating your children at the age of 9 to 14 years for this HPV vaccine. Nurture the future. Adolescence, a beautiful stage of life. Adolescence who controls the present and controls the future. India is home to 253 million adolescents, which is largest in the world. Their health and wellness is utmost priority. Hence, we have initiated cervical cancer vaccination program for the adolescent girls. As I already told you, WHO recommends single dose vaccination for the children aged between 9 to 14 years. This could be the game changer for the prevention of the disease. This will enable more girls to be vaccinated and thus preventing cervical cancer. And all its consequences occurs during their lifetime. So single dose recommendations enable us to reach our goal of having 90% of girls vaccinated between the age of 15 by 2030. So stand against cervical cancer and get vaccinated. Vaccinate the girls between age group of 9 to 14 years, roughly at standard 5th or 6th. So I recommend you all go for routine health checkup once in 6 months, pap smear or HPV DNA testing to for the cervical cancer. And you can do clinical breast examination to identify any lump in the breast cancer. Then mammography once in 2 years, and simply one gynecological examination every year. Get your ultrasound, that's transvaginal internal scan, every year. Thank you. Any questions I can see? Also, I want to tell about the vaccination. Recently, the Indigenous vaccine for the cervical cancer, introduced by the Serum Institute and launched by our health minister the last month. The cost, the other Gardasil and Cervarix, the cost is very high. But when the Serum Institute vaccine, probably the cost will be affordable. Soon it will be available in the market. So everybody can start initiating for your children this vaccine and get utilized and stand against cervical cancer. Any questions, Nikita? Within the private chat. I'll wait for some more time. For any questions, I'll answer it.